Question I get all the time around osteoarthritis, particularly because of the language being degenerative osteoarthritis, is because I have osteoarthritic knees or degenerative arthritis in my knees, does that mean that I 100% will end up needing a knee replacement? And sometimes people don't even ask it as a question. Some people, it's a statement. They'll come into the consultation and they say, I really want to delay if I can, but because I have degenerative disease in my knees, I will need a knee replacement at some stage, which isn't actually the case. For some people, absolutely they'll need a knee replacement because the pain and discomfort and limitation on their life is so great that it's impacting their everything. And so it's beneficial for them to go ahead and do it. But for a large portion of people, that's not the case. And the way to think about arthritis, I guess, is on a functional continuum. If this is a patient or somebody's age or time, say, rather than age, and this is your function, that when you're young over here, let's call this like maybe 15 years, 30 years, 50 years, 75 years old. So over here, function is good, no problems at all. You maybe have a few problems with your knees around in your early 30s, or you do something and then at some point you injure your knee. So maybe you were playing soccer with your kids, or maybe you were playing sport when you were younger. Anything can happen along here where the decline starts, but usually there's an injury that causes a bit of a precipitation, a bit of a quick decline. And arthritis, from there, when the arthritic change starts to set in, and for effect we'll change colours of pen, arthritic change starts to set in, and we go like, there's these ups and downs like this, right? Now, good times, bad times, good times, bad times. Now, if you do nothing, if you just avoid pain and avoid the things that irritate it, so in I guess to try and avoid the discomfort, and it actually ends up having the opposite effect. So what happens is this line starts to go downhill fast, like this. And so doing nothing will steepen the decline. You're still going to have ups and downs, but it steepens the decline down to like need a total knee replacement, unhappy days. Yeah. Now, where exercise or understanding that by moving better, by changing how you do some things, and by understanding your capacity, then building that capacity from there to do things you didn't think you were able to do, it flattens out this line. So you're still going to have ups and downs like this, like it's still going to be one of those lines, but ideally your knees last well until like you beat your knees to the ground, basically, is the idea. Now, this isn't always the case, but in a large number of cases, the more proactively you work at being able to do the things that you want to be able to do, the stronger you are, the more stable you are, the more mobile you are, the longer you'll get out of your knees without needing a total knee replacement. If you avoid things, then the total knee replacement will rush up on you quite a bit.